60-year-old lady with contracted gallbladder presented with acute calculus cholecystitis. There were few omental adhesions, and after release, apparently the area we are dissecting seems to be at the level of the neck of the gallbladder, and here seems to be the cystic artery branches on the gallbladder, which we are now coagulating. Some dissection of the gallbladder at the level of its body. Now dividing the artery on the gallbladder wall. Expecting the cystic duct somewhere here. But there seemed to be another part of the gallbladder medially, and the narrow part is here, so it is a dumbbell shaped gallbladder. We decided to go Fundus-first, so dissecting at the level of the fundus and going medially. It was because we are not sure about the anatomy at the Calot triangle, so did not want to do any injury to the common hepatic duct or common bile duct. Here most of the dissection is complete. We are now trying to find the cystic duct and dissect it. Dissecting some areolar tissue here. On the posterior aspect, we stop dissection because sometimes due to pool of fibrous adhesions, the bile duct comes here, and on the upper aspect also considered the similar problem, so we did not try to complete the division of those apparently fibrous tissues. You can see the cystic duct here, and it is difficult to create a plane to dissect it and separate completely from adjacent tissues. So we decided to divide it at the junction with the gallbladder partially, and yes, this is the cystic duct opening. We did not complete the division because we are planning to do transfixation. We did not complete the ligation, just half of cystic duct wall was tied, and now we are dividing the gallbladder from cystic duct by sub-seromuscular dissection, and now cystic duct is completely separated from the gallbladder lumen, and we are now completing the ligation. Now we are completing the division using ligation. Now the specimen is put into the condom, the needle with the remaining thread. A drain is kept so that if there is any leak from the cystic duct,